Hello students, let's study embolism. An embolus is a detached intravascular abnormal mass of undissolved material, so either solid, liquid or gaseous, which is transported by the circulating blood from point of its origin to another part. Types include thromboembolism. 90% of all thrombi, they are thromboembolism. Then air embolism, fat embolism, cholesterol embolism, tumor embolism, bone marrow embolism, and foreign body embolism. First, we will discuss thromboembolism. When a thrombus gets dislodged and circulate in blood, it is known as thromboembolism. Thromboembolism is further of two types: pulmonary thromboembolism and systemic thromboembolism. Now, the pulmonary thromboembolism. The thrombi, which get detached from veins and are then carried to the pulmonary circulation when they get impacted. Where they get impacted. Origin of thromboembolus is deep veins of lower extremities in 90% of the cases. Iliofemoral vein is most common. Then pelvic venous plexus, right side of heart, and other causes of hypercoagulable states. So this picture is depicting the embolus from deep vein thrombosis. The emboli is detached and travel to the heart. Pathogenesis of pulmonary thromboembolism. Site of origin is right ventricle. Thrombus is present in right ventricle. Then it will travel to the pulmonary artery. If embolus is large, then impacted across the bifurcation of pulmonary artery, known as saddle embolus. It will cause obstruction to the pulmonary circulation, leading to infarction. If more than 60% blockage is there, then it may cause sudden death. So this is the saddle embolus. Another is paradoxical embolism. Rarely an embolus passes through an existing septal defect in heart, ASD or VSD, atrial septal defect or ventricular septal defect. So the embolus enters the left side of the heart, bypassing the lung. Then emboli enter the systemic circulation. So it is paradoxical embolism. The embolus is dry, friable and granular. Embolus is not in the shape of the blocked vessel as it is formed somewhere else. It tightly blocks the pulmonary vessels and its removal is difficult. Fate of pulmonary thromboembolism. It is asymptomatic in 60 to 80% of the emboli are small, as 60 to 80% of emboli are small and they do not manifest. They are asymptomatic. They get organized and blood flow is restored, or it may cause pulmonary infarction. Causes: embolic obstruction of medium-sized arteries generally does not cause any infarction in lung, as lung has dual blood supply. So blockage of one is compensated by the other. However, if the person is suffering from CHF or chronic lung disease resulting in sluggish bronchial artery flow, embolus may result in infarct. Embolic obstruction of small end arteriolar pulmonary branches causes infarction. The clinical picture: patient may have cough, stabbing pleuritic pain, dyspnea, hemoptysis. Massive pulmonary embolism causes sudden death and cardiovascular collapse. Pulmonary hypertension with right heart failure are called pulmonale with multiple embolism. After pulmonary thromboembolism, coming to systemic thromboembolism. It is defined as embolic phenomenon occurring within arterial circulation. Site: it could be intracardiac thrombi, 80 to 85% are intracardiac, known as mural thrombi. Left ventricular infarction, 2/3 cases. Left atrial dilatation and fibrillation, 1/4 of the cases, due to mitral stenosis or cardiomyopathy. Or it could be in ulcerated atherosclerotic plaque, at aortic aneurysm, bacterial endocarditis and valvular vegetations, paradoxical embolism, 10 to 15% of emboli, they are of unknown origin. Effects and complication of systemic thromboembolism is infarction due to obstruction. Lower extremity could be affected in 75% of the cases. When infarction in brain, then cerebral infarction will occur. It will cause renal infarction, could cause myocardial infarction or intestinal gangrene. It may cause septic embolism, mostly from fragmented vegetations of bacterial endocarditis. Now, another embolism is fat and marrow embolism. The fat globules are released in the circulation, leading to fat embolism. This picture is showing presence of fat in the vessel. Bone marrow embolus in the pulmonary circulation. The cellular elements on the left side of the embolus are the hematopoietic precursors, with cleared vacuoles represent the marrow fat. The relatively uniform red area on the right side is early organizing thrombus. Etiopathogenesis of fat embolism, 90% of severe skeletal injuries, they have fat embolism, but 10% manifest clinically. So causes are fracture of large bones, femur, pelvic bones, multiple fracture of ribs, tissue trauma, burns, sickle cell anemia, cardiac bypass surgery, diabetes mellitus, and pancreatitis. These are asymptomatic and only around 10% they manifest as fat embolism syndrome. Fat embolism syndrome genesis. The fat emboli, it will either occlude the pulmonary vessels or either it may passes through the pulmonary vessels, leading to the systemic circulation and lodge in multiple organs like brain, kidney, skin, lungs. Fat emboli, it will occlude the pulmonary and cerebral microvasculature along with platelet aggregation and RBC deposition that will aggravate the occlusion and will lead to infarction, or the fat globules releases the free fatty acids leading to toxic injury to the endothelium. Platelets get further activated along with deposition of granulocytes and will release free radicals, proteases, iconocytes, leading to further vascular injury that will further cause infarction and manifest as fat embolism syndrome. The symptoms of fat embolism syndrome, it appears after 1 to 3 days of injury. Patient have fever, restlessness, dyspnea, tachycardia. If brain damage is severe, there may be irritability that will progress to delirium, coma, and death. Thrombocytopenia will cause platelet skin eruption, subconjunctival hemorrhage, and retinal hemorrhage. Another embolism is air or gas embolism. Certain conditions may lead to circulation of bubbles of air or nitrogen in blood. They coalesce to form frothy masses. Small amount of air or gas do not cause any problem. In excess of 100 cc can cause mechanical obstruction to blood supply, causing ischemia and infarction. Causes: during delivery or abortion, puncture of veins during invasive procedures, hemodialysis, during thoracocentesis or injury to chest wall and lung. Air or gas embolism, it will cause the decompression sickness. It occurs when individuals experience sudden decrease in atmospheric pressure Scuba and deep sea divers, underwater construction workers, and individuals in unpressurized aircraft in rapid ascent are all at risk. When air is breathed at high pressure, increased amount of gas are dissolved in the blood and tissues, particularly nitrogen. If the diver then ascends too rapidly, the nitrogen comes out of the solution in the tissues and the blood. Coming to amniotic fluid embolism. It refers to entry of amniotic fluid containing the fetal tissues and debris into the maternal circulation through tear in the placental membrane or ruptured uterine veins. This is the microphotograph showing the amniotic fluid embolism. Two small pulmonary arterioles, they are packed with, these are the pulmonary arterioles, they are packed with laminated swirls of fetal squamous cells. There is marked edema and congestion elsewhere in the lung. Incidence of amniotic fluid embolism is 1 in 50,000 deliveries. Mortality rate is high, 80%. It is the fifth leading cause of maternal mortality worldwide. Predisposing cause of amniotic fluid embolism is advanced age of pregnancy and multiparity. Pathogenesis. Amniotic fluid containing squamous cells from the fetal skin, Lanugo hair, fetal fat from vernix gaseosa, mucin from fetal respiratory or GI tract. When it enters the uterine veins, then it go to the maternal pulmonary vasculature. When it enters the pulmonary vasculature, it will either activate coagulation pathway leading to disseminated intravascular coagulation that will further lead to bleeding and death, or it will cause anaphylactic shock that will lead to coma and death, or it may cause pulmonary vasoconstriction due to prostaglandin F2 alpha, which is present in amniotic fluid, that will further lead to ARDS, acute respiratory distress syndrome. Amniotic fluid embolism, it will cause sudden onset of severe dyspnea, cyanosis, hypotension, followed by seizures, coma, and death. This is all about embolism. Thank you.